I thank the gentlewoman. I associate with everything the gentlewoman has said in this regard, and I would add that we have the same goal that this amendment describes. I simply think we have a better way to do it. I think it's pretty arrogant for us to sit here at the level of the federal government and think that we know best what to do with the people's money. The people know best what to do with their money. And when you give the states and local governments the flexibility to determine these three things: who is poor, what the poor need in terms of health care, and how the poor should get it, you can go a lot further with the dollars that are allocated for these kinds of programs, and therefore get a much better result. Exactly what happened in Indiana with the Healthy Indiana plan. Covered 40,000 more people without adding 1 cent of extra cost. Medicaid is for the poor. Medicaid should not be for the middle class. Medicaid should be for the elderly and the children who cannot afford it. And by the way, when I talk to middle class families in my district, more often than not what I hear is that it will be their highest honor to take care of their parents in their old age at their expense, not put them off on some federal program run by unnamed and unaccountable bureaucrats. I think that's the wrong thing to do. Let's give the states, let's give the people the flexibility to handle health care for the poor in the way they see fit. I also see that this amendment discusses the donut hole, the quote-unquote donut hole that was supposed to be patched by the Affordable Care Act. I think I could actually prove it here that the donut hole provision of the new health law has the effect of increasing drug prices, and to that end, I'd like to enter into the record a November 4th, 2010 letter from the Congressional Budget Office to the chairman of this committee in response to his questions about costs. Without hearing objection, so entered. The testimony is riveting, Mr. Chairman, I can tell.
Doing great.
In fact, the chairman requested an analysis of the specific donut hole provision from CBO, and CBO confirmed these new requirements will actually drive up health care costs at odds with claims made by its proponents. In fact, in one part stating, and I quote, "The premiums of drug plans will increase along with the increase in net drug prices, comma, so the premiums paid by beneficiaries will definitely increase slightly," unquote. And with that, I'll